Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
The Pharmacy Vision Awards from Vizient celebrate values and achievements of our program participants. The Excellence in Clinical Practice Award is granted to an organization that implements novel clinical practices to improve patient outcomes and reduce the cost of medication utilization. With me today from the Cleveland Clinic are Doctors Jona Banzon, Director of Outpatient Operations for Infectious Disease, Pooja Cerrato, Clinical Pharmacist, Travel Medicine and Infectious Diseases, and Kaitlyn Rivard, Infectious Diseases Clinical Specialist. I'm Gretchen Brummel, Pharmacy Executive Director in the Vizient Center for Pharmacy Practice Excellence, and your program host. Welcome to the podcast and congratulations on this award.
Thanks, Gretchen.
Thanks. Happy to be here today.
Yeah, thank you for having us.
Tell me about your backgrounds, roles, and your organization. Pooja, why don't you start?
Absolutely. I have been a pharmacist at the Cleveland Clinic for a number of years. I started my career as an inpatient pharmacist in internal medicine post-residency. And in the last couple years, I've come into a new role as the lead pharmacist for our virtual travel clinic, which is a ambulatory care role, very different from where I started. And in my current role, I am the lead for our travel clinic, which sees patients who are traveling internationally.
And my name is Kaitlyn Rivard. I am one of the infectious disease clinical pharmacists here alongside Pooja. I have a little bit of a different role. I am the pediatric infectious disease pharmacist, and then I also spend half my time overseeing the Cleveland Clinic vaccine initiatives for the health system. That's really how Pooja and I interface. Is travel is very vaccine heavy, and so I support the travel clinic through vaccine initiatives.
And I'm Jona Banzon. I'm an infectious disease specialist for the Cleveland Clinic, but I really jumped on this project as my role in outpatient operations. I'm the director for outpatient operations for our infectious disease department. And I oversee the logistical part of creating the clinic, driving patients to the clinic, and everything that comes with operationalizing our travel clinic.
Well, thank you for those backgrounds, and I'm excited to hear more about your work. But before we dive in, is there anyone else that you'd like to recognize as part of this award?
The creation of this travel clinic came with the support of a whole team of people. Specifically, when we created this, we had the support of our travel clinic specialists, Dr. Patricia Bartley, Dr. Stephen Mahorter. We also had operations assistants from Dr. Bethany Lehman, Andrea Pilata, who is the clinical coordinator for the infectious disease pharmacists, and our department chair, Dr. Stephen Gordon, who really had the original vision for this clinic. We also are supported by our administrative team, Kim Delzeith, April Spivey, and Teresa Hahn.
We would also like to acknowledge pharmacy leadership that supported this initiative, specifically our manager, Sarah Case.
So many hands to lift up this work. Good to hear. You won this award based on your work building a travel clinic. How did you first identify the need for this?
To give some background, there has always been a need for a travel clinic in general. People need vaccines, need medications, especially when they travel internationally. The services in the Cleveland area have been rather limited, especially prior to the pandemic. One of the reasons that our department ourselves could not sustain this was the lack of physician availability. There was just not enough time that could be devoted to supporting a travel clinic that was run by physicians. Secondly, our physicians were located in a very central location in one clinic in the main Cleveland Clinic campus, which is not that accessible to a lot of patients. They don't like driving downtown, and they had to go there just to get their vaccines and their evaluation. So those are the gaps in service that we had identified prior. And with the expansion of pharmacy support in our department, we started to think about how else we could leverage having pharmacists help us with our clinical roles. During COVID, the telehealth opportunities and platforms increased dramatically. And so between the use of pharmacists pharmacists to assist us clinically by using consult agreements and the ability to deliver telehealth medical care during COVID. The idea came together. This was the brainchild of our department chair and Andrea Pallotta, who saw the niche that we could develop using our pharmacists and our physicians to collaborate.
Andrea and I had been meeting to discuss our business plans for the next year, and she told me that Dr. Gordon had approached her about the travel medicine clinic. And the initial iteration had actually been for the department to hire 1 or 2 advanced practice providers, either nurse practitioners or physician's assistants, and then to have a pharmacist, likely me in my vaccine role, support those APPs with my vaccine expertise. And this was at a time when Ohio pharmacy law had been changing, that really had expanded the scope of the pharmacist. And that's where we were like, could we just have a pharmacist do the visit and order the medications under that consult agreement? We went back to Dr. Gordon to say, rather than APPs who would also be perfect for this role, if we feel like there's going to need to be pharmacy support, could we do a pharmacist instead and have a single person have this expertise and fill this role? That's where the stars aligned with the changing Ohio pharmacy law and the growing pharmacy support from our ID department.
Well, what a fantastic approach. You were looking for creative ways to serve patients, and pharmacy was a great partner to make this happen. So seeing some wonderful synergies here. How did you start pulling this clinic together?
It all hinged on identifying the right pharmacist to lead the clinic. When we were designing this, we all agreed that we should get somebody identified early on to build this clinic from the ground up. So not just be the person delivering the service, but that same person would stand it up from the ground up so they know exactly everything that goes into creating this clinic and can have a direct role in shaping how the clinic would look like. In the beginning, we weren't really sure how to formulate this clinic. We had our identified gaps to fill and our possible mechanisms or solutions, but the final shape of the clinic evolved as we went on through the project. We found the perfect person in Pooja, who jumped right in and took the reins on this project. One of the first things that we had to tackle was to get the consult agreement in the right form so that she would have the ability to deliver the service independently of physicians and identify the scope and procedures that she would be responsible for.
Thanks, Dr. Banzon. Coming into this role, we had a few physicians that were practicing in this clinical space that were seeing patients, but this version of the travel clinic didn't exist. As we were working on that consult agreement, the legal piece of being able to provide these services, I was also working on a few other things for my own professional development. I was previously a pharmacist in internal medicine, and I mostly worked with inpatients, which was very different than the outpatient role. So really embracing what that looks like. Additionally, there's a whole body of knowledge that's associated with travel medicine. And although I did have a bit of a background caring for patients with infectious diseases, that didn't necessarily translate into that knowledge related to travel clinic visits. As I soon learned, there was so much more to travel medicine than what I had originally expected. Some of the things that I was working on in the background, I completed training with the International Society of Travel Medicine, and then just this year was able to gain certification from ISTM. And then additionally, I did about 6 months of shoulder-to-shoulder training with our infectious diseases physicians that practice in the travel medicine space, to understand the way that they practice and the types of vaccines that are used in travel medicine, medication prescriptions, the type of counseling that is also done for patients, and some really unique scenarios. My background is practicing specifically with adult patients. One thing that I really had to learn here was how do we also take care of our pediatric patients in addition to adult patients. With the help of the pediatric infectious diseases physicians and quite a bit of training on that side as well, I was able to bring those patients in and facilitate more of family and group visits, which is the current iteration of the travel clinic.
As we were getting all those foundational pieces together, we also were busy thinking about the logistics of how this new clinic would be delivered. The telehealth space that really expanded with COVID just gave us an idea of how do we make this more seamless for patients, for referring providers, and cut out the need to physically drive to a remote location downtown in our main campus and make it more accessible for patients to get this service. As we were looking at this, we identified an ideal state. Telehealth approach would be great. After the telehealth visit, can they get their vaccines somewhere local to them? Or do we have enough Cleveland Clinic pharmacies for them to go to? Lastly, most people travel in groups or families. Can we figure out a way to serve the entire unit, the entire family, the entire group at the same time? Because they would likely need very similar counseling, very similar vaccination and medication needs. Can we do this all in this new clinic that we are creating so that it would meet all of these needs? Those were the logistics that we had to work through, all in the background of having to navigate some of the legal limitations of the consult agreement, of having a pharmacy be the clinician in this space.
And then the last piece, with this being a virtual travel clinic, primarily with Pooja seeing patients via telemedicine, is patients have to go somewhere to get their vaccines. And so we were able to collaborate with our health system ambulatory pharmacies to have hubs throughout our community for patient referrals to go get their vaccines and then their prophylactic medications as well. We took a lot of time to collaborate with those partners. At the time, our pharmacies were only offering vaccination to patients 12 years and older, despite our Ohio pharmacy law allowing vaccination 7 and up. Took a lot of discussions on what people felt comfortable with. Even though the law allows 7 and up, does everyone feel comfortable and well trained to vaccinate a 7-year-old versus a 12-year-old? And we had to create new protocols for all of the travel specific vaccines that we didn't previously have. In my role as vaccine coordinator for the health system, working with Pooja to outline what our standing orders and protocols for vaccination in the pharmacy settings would look like for our pharmacists to be able to act on using Pooja's recommendations from her travel. And then in Ohio in particular, each site that administers yellow fever vaccine has to be registered with the state health department. And so we had to go through all of that registration and training to be able to do that, which was a longer process than we expected. That came with its own pain points, and Pooja and I learned a lot through that process. It took us a little bit longer than we expected to get all of that set up just through the logistics and the scheduling. We were fortunate that we were able to eventually incorporate it as seamlessly, and we're now able to schedule patients' appointments to go to the pharmacy to get their vaccines while they're in their virtual travel clinic. We can actually get that appointment scheduled for them.
Fantastic demonstration of collaboration. Once you checked off those comprehensive background items to give you a solid foundation, what services did you eventually decide to offer?
Up till now, we've talked pretty abstractly about what travel medicine or a travel consultation is. Imagine that you're traveling to a particular international destination. Maybe you've always dreamed about traveling to Peru, doing some hiking. That's just a good example of a patient that would come to see me in travel clinic. The patient can do their visit from the convenience of their own home. I go through what the itinerary looks like, what specific activities the person is going to be engaging in while they're traveling. And it's also a really in-depth look into their past medical history, their current medications, and trying to prepare that traveler for health concerns that may arise during their trip, completing a risk assessment for the traveler, talking about potential health hazards that they may experience, and then ultimately managing risk. Maybe that is through vaccinations, particular medications, and then a real emphasis on the education piece or the counseling piece for travel. Travel medicine is a really specialized area, and it requires an in-depth knowledge of not only immunizations, but risks associated with specific destinations, and then the implications of traveling with certain medical conditions and how to manage those risks as well. Travel medicine consultations can be really beneficial for people with a complicated health history, such as someone who's immunocompromised or someone who's pregnant, for example. Sometimes for very young pediatric patients as well. The example that I gave you for Peru, maybe someone who's traveling to an area of high altitude. It's a very interesting field, but we try to make sure that the person who's traveling is ready for that travel and has all of the knowledge that they need to make it a wonderful experience. And then from a medical side, that they're also protected in any way that we can do that. Once that visit is complete, I'm able to decentralize the rest of the services. Medications can be sent to a local pharmacy for the patient, and then they can go also to a local pharmacy to get their vaccinations. We also coordinate with their primary care to see if there are certain vaccines that can be given in that space. Coordinating that entire care experience for the patient during travel and after travel. We ask that patients can reach back out to us if they have any questions or concerns, and we also do a follow-up check with them after travel. A comprehensive process, but something that we hope will make the travel experience more enjoyable for the person.
So really that comprehensive medication management, it's really important to highlight the fact that you all have chosen this clinic to cover all age groups. One of the things that you pointed out, pediatric patients are especially challenging for this type of clinic because of dosage formulations and that type of things. I know I've struggled with recommending malaria prophylaxis for younger kids, depending on where they're going and what the needs are for that population. Thank you for sharing that. What has been the impact of the clinic?
It's provided access for our patient population that had not existed for a long time at the clinic. That has been phenomenal. And we could see that manifested in the demand of how many people have been using our clinic services. It is now seamless to get a referral, get scheduled, get seen at your own time in the comfort of your own home, and then be able to get the vaccines and the medications somewhere very local to you. That has been huge for our patients. It also helps with adherence to the recommendations. If it's easier to get the vaccines and the meds locally and you don't have to drive somewhere far away, that certainly helps with adherence. It helps with patients deciding to even get a travel visit before they embark on their international trips. This helps protect everybody overall and makes your travel safer and more fun. We've been able to provide this service to Cleveland Clinic employees who travel for work-related issues, but also for Cleveland Clinic patients and even employees who travel for personal reasons. We've seen a lot of that recently. As the operations lead on this, I can attest that Pooja's clinic is very in demand. It's almost always full. It hasn't slowed down. This is coincident with the travel that we are seeing after COVID. People want to go far away places, exotic places, and having this travel clinic helps them do that in a safe manner.
We've seen a very positive impact with our primary care providers appreciating the service as a place they can refer their patients to. Before this service was available, they really took the burden of needing to make recommendations. Their patients would reach out to them saying, I'm traveling, and the primary care provider would need to do their best to use CDC recommendations to provide recommendations to their patients. But it perhaps wasn't as comprehensive as what clearly as a travel expert can be providing. We've certainly seen really positive high uptake with PCPs referring their patients to the travel medicine clinic. And I think they really appreciate being able to have that resource available that they can utilize rather than needing to muddle through the CDC recommendations that are not always the easiest to look at if you're not doing it day in and day out.
That's a really good point because our primary care providers are being asked to do more and more. So if we can take some of the burden off of them by referring patients to this travel clinic, that's a great opportunity to streamline care. Thanks for sharing that. What barriers have you overcome in this process?
One of the initial barriers that we encountered was how do we meet the requirements from a legal standpoint in terms of the consult agreement in getting those referrals sent to pharmacy? The consult agreement that we have essentially states that a patient who is established with the Cleveland Clinic provider may refer the patient over to us. Those were the initial challenges that we had is how do we educate PCPs and providers that this clinic exists and essentially how to order those referrals. And that was a lot of behind the scenes work, IT work, creating an in-basket, a place where referrals would go and they would get addressed, education with our administrative staff on how to handle those requests, and then ongoing education on what do we do when we have potentially someone who needs services but may not be established with our health system. That's been a really interesting partnership that we've been able to have with our primary care folks, again, is the ability for a patient to have services for primary care, somebody who may not have previously been established with primary care, and then that primary care provider being able to refer the patient over to travel clinic. Having that partnership, understanding that in travel clinic, we don't manage those primary care issues, but somebody should be keeping an eye on those things. For the patient to really be taken care of fully, it's important to have both of those pieces. That partnership has been really nice as well to address one of those challenges.
Another barrier that we encountered that we've been able to overcome is really the referral to the ambulatory pharmacy. We do have an age-based constraint in that ambulatory pharmacies are only able to vaccinate down to the age of 7 here in Ohio. And so our clinic sees patients of all ages. We've really been able to form partnerships with our pediatricians to refer patients back if they need travel vaccines to their primary care provider, with the exception of yellow fever vaccine, since that does require special registration to be able to administer. We've collaborated with our pediatric infectious disease physicians to have a centralized pediatric hub where we can have patients under 7 come to get their yellow fever vaccine in a clinic setting outside of the pharmacy. But certainly that is always a challenge when we have a family and part of the family can go to the pharmacy and then they have to take their younger children back to the pediatrician or to this clinic to get their vaccine. So it's a workaround, but it still does allow for everybody to get their access. The other challenge that we've really been working through is just bottlenecks. The demand has been so high that as we see patients in clinic, do we have sufficient slots in our ambulatory pharmacies to get them in for their vaccines in time for their travel? We have monthly or quarterly meetings with our ambulatory pharmacies that provide vaccine services to ensure that we're meeting the demand of the travel clinic, while also ensuring that our ambulatory pharmacies are appropriately staffed and able to conduct all the things that they need to do in addition to vaccine services. We've been able to develop a very positive partnership and come up with creative solutions, including identifying new ambulatory pharmacy sites that we're going to expand to in the upcoming year, and staffing opportunities, rearranging where folks are staffing so that way we can get more vaccines in arms in our higher volume clinics.
So it sounds like you've been very busy, and with all of your successes, are you looking to expand this clinic?
We are definitely looking to expand the clinic. We are investigating a few ways that we can do this. At this point, we have an idea of how many referrals we're getting each month, which is somewhere in that 140 to 150 patient range. Just trying to understand what that looks like moving forward. And this has been with very minimal communications, both internally and externally, has been very successful. And we would like to push forward those internal and external communications to our employees and to Cleveland Clinic patients about the availability of this service. But one of the challenges that we are having is that if we push out those communications, we need to be able to accommodate those additional folks who would like those services. In order to meet that demand, we are looking at a few different potential options. One thing that's up and coming is the potential for shared medical appointments. And I think this is a wonderful idea because travel medicine is very counseling heavy. And it's a nice way with a shared medical appointment for people who are traveling to similar destinations to get similar information, but then also be able to ask questions, and then potentially other patients within the same visit are able to learn from those interesting questions. I'm really looking forward to that up and coming in travel clinic. And then we are looking at providing services at different hours, potentially weekend hours. We would like to add hopefully a second pharmacist in the future.
Well, that's great news. Well, you started this award-winning travel clinic. What advice do you have for someone looking to model your success and start a clinic of their own?
We have a whole team and support network who are behind this project, and we could not have done it without them. Identify who your team needs to be, really listing down all the different pieces that have to come together, from legal, from the electronic medical record, from the scheduling team, and then pharmacy teams, billing, marketing. All of these components have to be identified and looped in as early as possible so they can help craft what the final clinic would look like. having a vision of what you would like the clinic to be. Although this can evolve along the path, but trying to identify from the start what sort of needs are you trying to address and what's your ideal state for this clinic would be essential to be your guiding path as you navigate all the obstacles and the procedures that need to be done.
We can't expect the clinic to be perfect and for everything to be done from day one. We need a version of the clinic that can start seeing patients. And then as we learn what's working and maybe what's not working, we can make those improvements and adjustments as we go. Having that mentality for us was so important. When we officially started the clinic back in April of 2023, it was not perfect. And there were a lot of things that we still needed to do and improve upon. Some things even now that while it does feel more like a well-oiled machine, there are definitely some issues with access that we are still trying to solve. That's the nice thing about a project like this, about an initiative, is that we can continue to work on pieces and parts of it, but at least it's in a good enough place where we can take care of our patients, which is really the most important thing.
Well, that's great advice here and in life in general. Is there anything else you'd like to share?
I really want to stress that, like so many other areas in medicine, the field of travel health continues to evolve. I felt like this was such a unique position for a pharmacist to be in, really practicing in this travel medicine space. And as I talk to other folks, other pharmacists, other professionals about this position, I often get the response, I don't think I've ever met another pharmacist practicing in travel medicines. This is such a new and growing area, and hopefully we can see more of this across the US, thinking through how well a pharmacist is suited for a position like this. Because travel medicine has that emphasis on patient counseling, medication education, and vaccine preventable disease, a pharmacist is very well suited for a position like this. Of course, the focus of travel medicine is to prepare a traveler for international travel. We really have to acknowledge the role of a clinic like this on public health. So we're really limiting the role that a traveler can play in the spread of disease through preventative measures such as medications and then both routine and travel vaccines.
For travel clinics, certainly pharmacy is a great partner for clinicians. But I think in general, as we continue to explore what else a pharmacist can do, we have really appreciated the close collaboration between our infectious disease physicians and our infectious disease pharmacists. There's so many more roles that pharmacy can help with in providing care for our patients. And I just am so excited to see other collaborations in the ambulatory space, in addition to the inpatient space, between pharmacy and clinicians.
Yeah, it's a great partnership, isn't it?
Absolutely.
Well, thank you all so much for joining us here today to share your perspectives and expertise. I'm so glad you could be here.
Thank you so much for having us today, Gretchen.
Yes, thank you. And thank you to Vizient for recognizing this important work.
Thank you, Gretchen.
And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.